UNICEF and other global agencies for the topic Principles and Strategies for Breaking Bad News. Let's welcome sir.
Over the years, there have been a lot of changes that have occurred in the concepts that are behind the breaking of the bad news. I just wanted to show you a film which has come in 1990, which is titled as Doctors, wherein one of the doctors suffers from cancer, and this is how the bad news has been broken.
Won't be pleasant. Time out. Hold it. Take it. Your hand. Head forward. And open. And see. Again. 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 One more time. And that's all I need. Back to level both.
What?
Tumor laryngeal. Here on the true vocal cord.
More laryngeals.
Chest x-rays, blood chemistry, blood count, UA, EKG. I have to check with my secretary, but if it's remotely possible, I'd like to do a biopsy tomorrow. Okay?
Thanks.
Look at me.
So that's the shock which the patient had. The doctor announced that he is suffering from cancer, and since 1990 in India there is not much of change that has occurred in breaking the bad news. My objectives of today's talk is to say a few words about what is effective communication in health, and what are the psychological impacts on patients and families, and what is PIPE's protocol, and finally what are the practical techniques wherein we can improve the breaking of the bad news. As we all know, communication is the most important aspect as far as Indian medical graduate is concerned, and when we are giving communication, it should be most effective, and effective communication has certain characteristics. The characteristics are it should be truthful, it should be certified. That means you should be damn sure that whatever you are talking is correct. It should not be something like 50-50. You may be suffering from cancer, you may not be suffering from cancer. It should not be. It should be certified and confirmed. And you should be sincere in uttering the news, and it should have some legality. When you are speaking about some news, legally it should be correct, because many times patients may be recording whatever you are saying. And it should be correct, and the language which you are speaking, it should have good quality. And finally, the patient should be able to understand and comprehend whatever you are talking. So these are the all qualities of effective communication in health. And why this effective communication is necessary, and especially while breaking the bad news, because it produces a perception of a good doctor. If you say whatever is true, then patient will be satisfied, and there's increased patient satisfaction, leading to good patient outcomes, increasing the effectiveness of your treatment. And it should be very safe when you say the correct things in the beginning of the treatment itself. If you don't say that and if you hide the diagnosis, what will happen? There will be physical and emotional harm to the patient and healthcare provider frustration because he will be hiding something and there can be burnout, and it also erodes trust on the physician and it will be wastage of resources and increased costs. So it is always better to say the truth to the patient as far as possible. Then coming to what is bad news. Bad news and good news are integral part of the everyday life. It features everyday life and experience. Say for instance, if you say good news today, it may become bad news tomorrow. I would like to narrate one of my friend's experience which happened recently. He is suffering from headache since last 3 months. He went to a neurologist who is also his classmate. Then he advised that he should take CT of the brain. So CT of the brain has been taken, and when it was shown to a neurologist said nothing to worry. There's nothing in your brain. So patient also is happy, but when he went back, his wife said, why can't you show it to another doctor? So he went to another doctor, and the other doctor said, why can't you go for a contrast CT? So he went for a contrast CT of the brain, and there it showed an aneurysm in the brain. So good news, which was initially that there is no disease, later on became a bad news. So it is all integral part of our life. And bad news is any information that changes patients' expectations in a negative way. So please remember that we may be thinking that it is quite normal. I asked one obstetrician, how do you declare IUGR to a pregnant woman? So he said IUGR is a common one which happens. So I tell my mother, expectant mother, and say your child is not doing well. But it's a bad news to the mother. So whenever you are uttering something, please be careful, and we don't know how the patients are taking whatever we are talking about. There are two things that can happen. Whenever we say bad news, we say that it is related with cancer, it is related with death, and it is mainly concerned with clinicians. But many times it so happens, as a clinical teacher, we will be dealing with bad news in education also. As a clinician, if there is an abnormal test results, then we have to break the bad news to the individual. And when you are not diagnosed in time, any disease, when you are not diagnosing the disease in time, then also it becomes a bad news. And end of life issues like untreatable cancers and other things, end of life issues is also a bad news. And there are certain patients who are challenging. Mostly we call them as Google educated patients. So in such situations, deciphering bad news is also very difficult. And the relatives who are half knowledgeable, it's also very difficult. In such situations, we have to be very careful. The capacity of the individual also makes it very difficult for us to break the bad news. The consent of the patient and keeping the confidentiality of the patient, and during the disease management, delivering the bad news is also a difficult situation. As far as a clinical teacher is concerned, the academic weakness of the student. So you have to call the student and then explain to him that he is academically backward. So it's a very difficult situation, especially to the informing the parents about their ward's performance is also bad news. Failure in the summative examination. When some students fail, as head of the institution, I face large number of situations where parents will come and say, why you have failed my student? So it's very difficult situation. Challenging with students' life. When the student is involved in substance abuse or alcohol use and all, then you have to tell this news to their parents. And indiscipline of the student, you have to explain to their parents. So these are some of the situations where bad news you have to decipher to the parents. The doctor-patient communication. has been evolving over the years. As we have seen in 1990, it's straightforward saying that you are suffering from cancer, but now so many concepts have come up and now it is evolving. And these two participants, the doctor and the patient, conduct one-to-one conversation in equal status. This we have to remember, that the patient is also equal with us and we have to talk at the same level. So what are the ethical considerations and cultural sensitivity which we have to keep in mind when we are deciphering the bad news? The non-verbal cues. Many times it so happens that patient is observing all of our non-verbal cues, the body language, when we are talking. So sitting in a very relaxed situation and then breaking the bad news gives a bad impression in the patient. So we have to keep attention to these aspects such as language and communication, non-verbal cues, tone and style of messaging, and sensitivity to taboos and traditions. So these are some of the things which we have to keep in mind. The ethical considerations are based on 4 pillars, as we all know: the autonomy, beneficence, and non-beneficence, and justice. Based on this, we have to keep in mind while deciphering the bad news. I saw one of the movies wherein the trainee doctors were given a role to understand what the patient feels in the hospital. I just wanted to show you that clip.
It's been an hour already. I'm out of here, people. Yeah, Ned.
Hi. Sorry I kept you waiting. Good. Okay, well. Can you strip naked and put on your hospital gown as quick as you can?
Dr. McKee, this is a joke.
I'm not laughing. Here's the... Alan.
Roger. Tony?
Let's go. Sarah. JJ.
Michael, anything, please?
Doctors, you have spent a lot of time learning the Latin names for the diseases your patients might have. Now it's time to learn something simpler about them. Patients have their own name. Sarah. Alan. Jack. They feel frightened, embarrassed, and vulnerable, and they feel sick. Most of all, they want to get better. Because of that, they put their lives in our hands. I could try to explain what that means until I'm blue in the face. But you know something, it wouldn't mean a thing. It sure as hell never did to me. So, for the next 72 hours, you'll each be allocated a particular disease. You'll sleep in hospital beds, eat hospital food, and be given all the appropriate tests. Tests you will one day prescribe. Unbelievable. You are no longer doctors, you are hospital patients. Good luck. See you in my round.
Why I wanted to show you this is, routinely we prescribe MRI or CT scan. How much the patient is apprehensive to go into a machine which produces lots of sounds, and if the patient is having claustrophobia, he will be frightened enough. So we have to go into the shoes of the patient and understand what is their culture, what is their sensitivity, and then only break the news. Whenever we are breaking the news, the most classical feature that has been studied after the AIDS epidemic is Kubler-Ross model, wherein the patient initially there will be shock. The one which I have shown you in the beginning, the doctor himself is in a shock whenever he hears the news that he is suffering from cancer, because it's a surprise which she is not expecting it, and then immediately there will be denial. And those people who are with grey hair, they still remember when the first AIDS case came into India and everybody predicted there can be AIDS epidemic in India. The highest authorities in India as well as every official used to say that India is a Ram Raj, so in the kingdom of Ram there cannot be something like AIDS epidemic. So there will be denial, and after denial there will be frustration. And this frustration sometimes leads to anger, and that anger they wanted to take revenge. Why should I suffer from this particular disease? Everybody should suffer, so they wanted to spread it. And later they will go into depression. As we have seen in many Telugu movies, when the heroine says no to the hero to marry or to fall in love, the hero resort to this depression and goes into alcoholism. And then there will be an experiment. Suppose if I accept this, what will happen? Then finally the individual will be able to accept it, the decision, and finally integrate it into a routine life. This is what happens whenever you break the bad news. And each of these cycles, the duration of the cycle varies. Sometimes the shock will be for few seconds or few minutes, and later on there will be denial or there can be frustration. But many times it so happens that people may be, for a long time they will be in depression. So the duration of each of these phases will vary according to individual. And this is the modified one which they said anger and sometimes bargaining. Bargaining is another stage wherein said, Doctor, this result might be due to some error in the laboratory. So can you recheck this and say whether this is correct or not? So the bargaining phase also happens sometimes whenever you are breaking the bad news. There are many models for breaking of the bad news. The most common one is the spikes, the ABCD and breaks and case 10-step model. These initial 4 models are mainly designed for cancer. When the cancer diagnosis is there, so these 4 models have been designed, and spikes model is the one which is famous and many people are using this. Later on, when there's abnormal results or some other diagnosis is made other than cancer and end of life, so the other models have come into play. The most common ones are Calgary, Cambridge and sunburn, and then sad news and so on. So I will be concentrating only on spikes model. In this spikes model, recently they have added one more word called as W. W stands for warning shot. So we will see what is that warning shot. So spikes stands for setting, perception, invitation, knowledge, emotions and strategy and summary. This is spikes model. Before we go into the spikes model, I would like to explain you the concepts behind this spikes model. There are 2 individuals. One is the one who is announcing the news, the other one is who is receiving the news. The one who is announcing the news, there will be certain changes before he announces, and during the announcement there will be certain changes in that individual. That individual may be a doctor. That is, we call it as 1A, that the internal changes happen to decipher the bad news. And secondly, there will be a medium through which we will be breaking the bad news. The kind of language which she is using, the ambience, timing and the place. And the second person is the recipient, there are two types of changes that occur in an individual. The first is 3A, that occur the internal changes initiated after hearing the bad news. And the other one is the changes that occur into an action. The action or the response from the receiver towards the person who had uttered the news. So after hearing the response from the patient, the doctor will have certain changes, and these are 1B. So this is the process, and this process we will describe it in detail now. Before announcing the news, there are certain characteristics which makes an individual capable of delivering the news or not. Then from the physician perspective, the education of the individual who is announcing the news and the professional training which he or she has received. And as we all know, majority of our medical students are not receiving any training in communication skills, and there can be variable natural common sense in the personal interaction of the medical students or the doctors. So that's the physician characteristics which influence the situation of breaking the bad news. From the patient perspective, what is the personal experience of that individual towards the hospital care and the doctor in particular? What is the education status of the patient, and what is the knowledge or ignorance of the patient, and the culture and family background? These are the characteristics which decide the response after hearing the news. So what are the changes that occur in the doctor before breaking the bad news or during the breaking of the bad news? First, he has to introduce himself, and then confirm that he is speaking to the correct patient, and then prepare. The doctor has to prepare before announcing this. He has to choose the words, he has to choose the language, and he has to choose the sequence of this talk and modulation. I really appreciated the modulation when the Air India flight crashed. The CEO of Air India spoke on television. The kind of modulation which he used is really appreciable. So the kind of modulation which the individuals are using while breaking the bad news is important, and they have to explain the purpose, and they have to take the consent of the patient and establish a rapport. Only after that you have to break the bad news, and you have to prepare for active listening as well as aggressive response from the patient. So be prepared for that. So that's the first change that occurs in the doctor. The second change after receiving the bad news, the patient will respond, and after responding, the doctor will have internal changes like emotions. Many times we cannot control our emotions. Sometimes after listening to the bad news, the patient may aggressively attack the doctor. It may be physical attack or it may be verbal attack. So we have to control the emotions, and we have to show the empathy. Control the reaction, and don't react but respond. The appropriate response is necessary. And prepare yourself the words, language, and the sequence which you have to pacify the individual. The modulation, explain with evidence, and reassure that there is nothing great that is happening. The ambience, the media which you are using, whether you are using face-to-face interview or are you using a telephonic one. Sometimes people use telephonic one to dispel the bad news, and it is not advisable to dispel bad news on a telephone. It is always better to have a face-to-face communication, and the language which the patient can understand, the timing, the situation, and the place where you are breaking the bad news. There should be no interactions, and it should be noise-free, and the presence of the other people, relatives. The presence of other people is a double-edged weapon. Sometimes the relatives or friends or the kith and kin may be able to understand better than the patient, and sometimes they will be more aggressive than the patient. So it's a double-edged weapon to keep the other relatives and friends or family members when you are discovering the bad news. But before that, you have to always take the concern whether the presence of them is required or not. So after receiving the bad news, the changes that occur, we have seen the Kubler-Ross cycle, wherein the shock, denial, frustration, depression, experiment, decision and integration. So these are the changes that occur in individual, and after these, during these changes, what will happen? The receiver will be responding. The response will be in the form of anger or the frustration or aggression or abuse, verbal or physical, or they can result in physical violence also. So as the physicians many times, the treating physician always afraid to dispel the bad news because of fear. Fear is because of emotional and psychological pain to the patient. Because it causes pain to the patient, so with that fear, the physician would not like to dispel the bad news. Or fear of guilt. Sometimes the doctors feel that I did something wrong, or I discovered something which is causing end-of-life situation to the patient, so they feel guilt. Or there can be sympathetic pain. I read one good novel which causes doctors do cry. So it says that doctors are not free from emotions. When you discover something in a patient and which is lethal to the individual, there will be emotional change in the doctor itself. So doctors do cry when the patients are dying. I have seen people who had a good rapport with the individuals. When they die, there will be certain emotional disturbances in individuals. So that's the sympathetic pain. And the shooting, the messenger therapeutic impotence. We are unable to treat many diseases. So this is therapeutic impotence. So we feel guilt that we are unable to treat an individual. And sometimes we have to be careful that we may be expressing certain emotions. When the patient is suffering from AIDS, we should not express that. Because of his previous deeds, he is suffering from that. So certain emotions, because that emotions may be outburst during the dispelling the bad news. So this is the fear which many physicians are having. Patient also will be having certain fear when people are called. As a dean, when I call the parents are apprehensive. They come with the fear saying that my child might have done something. So that's why. So similarly, when you call the patient and when there is calm room and quiet, and when you are saying that I wanted to discuss few things with you in person, so they have certain fears. So what are those fears? Fear of having a physical illness, or fear of having psychological effects, fear of death, fear of treatment, fear of friends and family members, and social and professional life obstructions due to the news. So similarly, relatives and family also will have certain fears. So fear is one thing which is the running in the background when you are discovering the bad news. So coming to what is the Spikes model. Spikes model is, number one is S stands for setting. The setting is the place where you are discovering the bad news. So minimize the distraction, and there should be privacy only between you and the patient, and involve others if you feel and the patient agrees to it, and establish a rapport and manage the time constant, because it should not be so prolonged. There should be time constraint for that. So setting is the most important one, and setting also includes that the doctor should be preparing well how to deliver the bad news. Then the perception of the patient, perception of the receiver. So what the patient knows. Initially you should ask the individual, suppose you have undergone so many tests, what do you expect? So do you think that you are having some disease? Patient's comprehension level you have to assess, and then the person who is delivering the news should also accept the denial. The denial is a common phenomenon. It's a natural phenomenon which occurs to any individual. And try to not to confront, saying that if the patient says that he or she is not suffering from the disease, do not jump and say, no, you are suffering from the disease. So do not confront with that. And then the third part in spikes is I. I stands for invitation. Invitation is asking whether the details are needed for the patient and accept the patient's right and then offer the correct answers. And the other one is called as K. K is for knowledge. The intelligible language should be used so that the patient can understand. And whenever you are delivering bad news, do not send it in one single sentence. Make it into small pieces and then make it into a small chunks of information. Here I would like to explain you one of my experience with one of the medical colleges here. So one day late night at 10:30 I received a phone call from the administrative officer saying that sir, you have to come here to the hospital. I said, why? Sir, some of our students, postgraduate students, went for a health camp. While returning back, they met with an accident and one of the students died on the spot. And another student received grievous injuries. That student is critical and the other two students received minor injuries and they were brought here. So you have to come and see them. So I went there. So the person who died on the spot, he was sent to government hospital there at the periphery. And the other girl, a postgraduate student, was brought here. She suffered a cut throat and their whole voice box has been damaged. She is unable to speak. The other two students are well. Then we made immediately arrangements for the girl to be shifted to higher centers. And then I routinely asked, have you informed the parents of the boy who died on the spot? They said no. Then why can't you inform them? So I said, sir, you are the right person to inform. The medical superintendent denied that he doesn't want to inform the bad news. So one thing we all should remember that in such a situation which is very serious, everybody pushes you to the front and you will be responsible for breaking the bad news. So I took the phone number and called the parent of that boy who died on the spot. And the parent is a professor of neurosurgery working in Chennai. I said what had happened. So what should I inform him? What should I tell? Whether I should tell that your child died on the spot in a major accident that happened, or whether I should not tell the news, or whether I should withhold it for some time. So what I did was, I said, your child went for a health camp and they met with an accident and it's a serious injury, so you have to come immediately. He's a doctor. So he said, what had happened? Tell me, what is that serious injury? Then he received some head injury. He is conscious, but you have to come. So he said immediately, I'll be on the way. His wife is also a gynecologist, so both of them started from Chennai. When they were nearing the place, then I informed them that your child could not be saved. So small chunks of information. On the way we kept constant contact with them and then saying that your child lost consciousness, your child got this. And finally, when they are reaching the place, then I told them that your child is no more. So small chunks of information you have to give, not immediate one. And try to understand the patient's understanding. And positive aspects first should be given and give the facts. Don't try to make them into false promises. And E stands for empathy. Identify the expressed emotions from the recipient and identify the source of emotions. What exactly is the factor which is causing that kind of emotions, and give them some time to express. Suppose after hearing the news, if somebody wants to cry, let them cry. Cry for some time and don't obstruct, and don't cry here. So let them cry, let them express their emotion. And later you can sympathize with them. And then finally the summary, ask for any further clarification, close the interview and offer the agenda for the next meeting. So follow-up is also an important aspect in the spikes model. So spikes model speaks about the setting, prepare yourself, and then P is the perception, ask the individual what do they think about their disease or their condition, and inform them. I stands for information and K for knowledge, and finally E for empathy and summary. So this is Spikes model. Spikes model works very well with clinician and patient. Clinician and patient in this setup or the setting, you have to gather information, all the information that is necessary to discuss. Please try to read about the particular disease you wanted to discuss with the individual, and identify the space and time and maximize the patient comfort. And finally, perception, in that elicit patient understanding of the condition and what it means for them as far as health is concerned. And invitation is allow the patients to ask for more information, more and more information. Patients share their preferences, including level of details they would like to know, and who else to be involved in that, and share very clear information preceding the actual one. In the spikes, the word W has been introduced as that W is a warning shot. Warning shot is that a shot which tells the seriousness of that particular condition, which gives an indication to that. During my telephonic talk, I said it met with a serious accident. Serious accident is a warning shot. Warning shot means I am going to break larger and worse news later on. So that warning shot has been introduced in this spikes model. And finally, the emotions and summary. Emotions and summary is the patients expect certain space and validate the responses, emotions and sympathy, and finally you have to summarize it. When it comes to education, as a teacher and a student, the learners have very few options. If you are saying that there can be something like patients have different options, can I take another doctor's opinion? So, but student has no other options. And this kind of teacher-student one is our everyday life, we are doing it. And in the beginning itself we talked about AI. So whether AI can be used in breaking the bad news. There are two mobile applications which can assist the medical person to break the bad news in a most efficient way. There are two applications. One application is called as Average, the other application is called as Suki. So these will be able to tell you what kind of questions to be asked and what will be the response and how you can prepare to efficiently deliver this news. But finally, no ethical AI tool should ever be designed to deliver bad news directly to a patient. It should not be directly delivered to a patient, it should be delivered to the individual who is responsible and who is the treating one. And the core act of delivering bad news, responding to emotions in real time and providing empathetic support and making shared decisions must be by an individual, not by an AI. And finally, to summarize, so there are four aspects which we have to remember. Plan. Plan, plan, plan. Plan how you wanted to deliver the bad news and prepare. Keep the settings ready and then perform. And finally, palliation, that is empathetically consoling the individual. So these are the four stages which we have to remember: plan, prepare, perform and palliate. Before I conclude, I just wanted to show you one clip. So after listening to this lecture,
और तुमसे? कर भी नहीं।
So thank you very much.